To the pandemic, as today the FDA approved COVID vaccines for infants and preschoolers, so they could be available starting next week. This also comes at the same time we're seeing high COVID case counts in 3 Oregon counties. That's Hood River, Curry, and Coos counties, where masks are now recommended when people are indoors. Lisa Balick joins us live tonight from downtown Portland with the latest in all this. And Lisa, I know a lot of parents have been waiting for this moment.
Yeah, there are a lot of parents who have been waiting, but there are also a lot of parents who are hesitant. There are about 250,000 Oregon kids who will now be eligible for this shot, but it may take a lot of convincing.
Until now, more than 250,000 Oregon children were not able to get a COVID vaccine. It's taken more time for the vaccine makers to figure out the right dose and monitor for any side effects for children ages 6 months to 5 years old.
I have to say that many families with young children are living like it's March 2020. They are afraid to have their children go to school or daycare, or even to receive needed medical care because they don't want to run the risk of getting infected.
It's anticipated both Moderna and Pfizer doses for that age group will be available here starting on Monday. Moderna is a 2-dose series, a month apart, each a quarter of an adult dose. Pfizer, a 3-dose series, each shot a tenth of an adult dose. The first 2 shots 3 weeks apart, the third a month later. More than 400 children have died across the country from COVID, including 8 in Oregon. COVID peaking here right now. Doctors recommend families don't wait until fall to get a child vaccinated.
This can prevent and minimize the likelihood of developing long-term complications that's often referred to as long COVID. So disease rates are fairly high right now in Oregon and the rest of the country. So having that protection on board as soon as possible will offer that protection, and will continue to offer some protection against severe disease in the fall.
The state expects to have plenty of little kid vaccines arriving here next week. The problem, though, may be overall lack of demand. Most Oregon children ages 5 to 11, a group already eligible, have not gotten a COVID vaccine.
Now, one other thing to keep in mind, you should check with your pediatrician if you're interested in your child getting the shot starting next week. Also, keep in mind, these are a series of vaccinations, so that even if you want to have your child protected by fall, it may take some time, so you may want to get started on those dosages now. Back to you.